Dental implants have been around for decades, but when they first came out, they were only being done by a few specialists throughout the country. And as they've become more popular, they've kind of grown. So now a lot of people are starting to get dental implants. What a dental implant does is it replaces teeth. Before dental implants came along, we had two options to replace teeth. We had the removable option, and we had the option of a bridge. And the downside with the removable option is some people just don't want removable teeth. It also requires a lot of extra hardware in the mouth that sometimes people just don't care to tolerate. The downsides with the bridge, although these options are good options, but they do have their pros and their cons. The downside with bridge is that sometimes you have to cut into good teeth on either side of your missing tooth to be able to get that tooth back. A bridge works by using this tooth here and this tooth here to support the one that's missing. So you've got to put a crown here and a crown here, and then 3 crowns hooked together get cemented on to replace the one tooth. If these 2 teeth on either side needed a crown, well, it's a good option financially. It's a great option. Also with these bridges, hygiene can be more challenging. You can't floss between crowns that are hooked together. And so sometimes people don't like to go through with what it takes to clean around a bridge properly. When you're not cleaning around a bridge properly and you've got these 2 teeth supporting 3 teeth, if you get decay on this one because you weren't willing to stick up with that extra work it takes to clean, and you lose this tooth, well, now you've got 2 teeth missing because you're using that to support a tooth. So there's a lot of things to consider. But with a dental implant, dental implants are such a nice way to replace a tooth because it's the closest thing that you can have to having that natural tooth back. A dental implant is a titanium screw-like device. It's very small, about 5 by 13 millimeters, and they're placed into the bone, and after adequate healing, which could be 4 to 6 months in your upper jaw and maybe more like 3 to 4 months in your lower jaw, during that time your bone is growing around that implant and locking it into place. Once the implant has locked into place, then what I do as a prosthodontist is I attach things to those implants. So if you are missing all your teeth and you get dental implants, I can attach a full set of teeth to those implants. If you are missing just one tooth, we can put one implant and attach a crown to that implant. If you're missing 3 teeth, we can put 2 implants and put a bridge on those implants. Implants have really changed the way that we replace teeth in dentistry. They've changed the way we do this because sometimes partial denture is not an option. If you've lost your teeth from here on, we can't make you a good partial denture that's not going to be a little detrimental to the teeth on either side and be stable. In that situation, we can't do a bridge because you have essentially, there's nothing to anchor to on the other side. So dental implants have opened opportunities that weren't there before. In the past, maybe people had to have their teeth removed to get into a full denture because a partial denture wasn't indicated. Well, now we can leave some good teeth and use dental implants to replace the teeth on either side.